This is my week 9 MRI presentation. Today I'm going to talk about how to do an MRI scan of the knee, ankle, and hip. And so the first thing I'm going to do is check my inquisition. I'm going to make sure I have the patient's first and last name, date of birth, and the diagnose for the type of exam they're going to get, as well as the doctor's information and signature. Once I have done that, I'm going to go ahead and demagnetize. I'm going to make sure I don't have any hairpins, earrings, necklace, watch, cell phone, keys, loop chains, nothing that's ferrous on my body. And then I'm going to go ahead and go into zone 4, the scanning room, and close the door behind me. And then I'm going to get some gloves and grab some hand sanitizing wipes to wipe down the scanning table, the coils, headphones, emergency squeeze ball. And I'm going to lower the bed, scanning bed, so that the patient can easily get on. And I'm going to put on fresh linen, such as sheets, pillowcase, and then I'm going to go grab my patient. I'm going to repeat that for each exam that I'm going to do for the knee, ankle, and hip. So once I have done that and I have shut the door behind me and have grabbed my patient from the lobby, I'm going to have them lie down in the scanning room, the scanning bed. I'm going to have them lie down supine feet first for starting their knee exam. The coil that I'm going to use for the knee exam is going to be an 8-channel knee coil, and the laser landmark is going to be the inferior patella apex. So basically, if this were the knee, you're going to just feel down the knee to the bottom of where the patella is, and that little crest, that's going to be the apex, and that's the laser landmark for that. After I have positioned my patient, I'm going to go ahead and run my scouts. And for an axial sequence of the knee, I'm going to plan the axial on the coronal plane. And then my slice angulation is going to be, I'm going to angle parallel to the medial and lateral condyle of the femur. And I'm going to cover from the tibial tuberosity up to the line of the superior patella, and I'm going to make sure I cover all the small tissue and joints. For the coronal sequence of the knee, I'm going to plan the coronal slice on the axial plane, and then I'm going to angle parallel to the medial and lateral condyle of the femur. And then the coverage, I'm going to cover from the anterior patella to the line of the popliteal artery. For a sagittal of the knee sequence planning, I'm going to plan the sagittal on the axial plane. And then my slice angulation is angle parallel to the lateral condyle of the femur. And my coverage, I'm going to cover from the medial to the lateral condyle. So for an MRI of the foot, I'm going to use a chimney coil. And the patient's going to be lying down, supine, feet first. And the laser landmark for this exam will be the metatarsals. And I'm also going to make sure I place padding around the foot to prevent or to help with the motion. Then I'm going to run my scouts, and for the axial foot, I am going to plan my axial slice on the sagittal plane, and then my angulation is going to be perpendicular to the metatarsals and phalange bones, and my coverage is going to be covered from the tip of the toes to the tarsal bones. For a coronal sequence planning, I'm going to plan the coronal slices on the sagittal plane, and my angulation is going to be angle parallel to the metatarsals and phalange bones, and I'm going to cover from the plantar to the dorsal aspect of the foot, so the bottom. And for the foot sagittal, I'm going to plan the sagittal plane on the coronal, and my slice angulation, I'm going to angle parallel to the metatarsals and phalange bones, and I'm going to cover from side to side of the foot. For an MRI of the ankle, I am going to have the patient position supine feet first, and I'm using a chimney coil, and my laser landmark will be the malleolus of the ankle. And the for an axial sequence of the ankle, I'm going to plan my axial slices on the coronal plane, and my angulation, I'm going to angle parallel to the mortise joint, and I'm going to cover just above the tibio-talar joint down to the plantar. For a sagittal of the ankle planning, I am going to plan the sagittal slice on the axial plane, and I'm going to angle parallel to the medial and lateral malleolus, and I'm going to cover from the outer aspect of the lateral malleoli to the outer aspect of the medial malleolus. For my coronal sequence planning, I'm going to plan the coronal on the axial plane, and then my angulation is going to be perpendicular to the medial and lateral malleolus, and I'm going to cover from the Achilles to the midfoot, Achilles tendon to the midfoot. For an MRI of the hip, I'm going to use a phased array coil and have the patient lie down supine feet first. The laser mark is going to be their hip joint, so I'm going to have them bend their knee up, and where the crest is, that's where I'm going to laser mark my my center. For a coronal sequence of the hip, I am going to put my coronal slice on the axial plane, and I'm going to angle parallel to the left and right femoral head. I'm going to cover from the ischial tuberosity up to the line of the pubic symphysis. For axial sequence, I'm going to place my axial slice on the coronal plane. I'm going to angle parallel to the left and right femoral head, and I'm going to cover from the anterior superior line or anterior superior iliac spine up to the lesser trochanter. For the sagittal sequence, I'm going to place my sagittal slices on the coronal plane. I'm going to angle parallel to the femur, and I'm going to cover from the hip. I'm going to cover the hip joint from the outer cortex of the greater trochanter up to the inner portion of the acetabulum. And that concludes my presentation.